A cricothyrotomy, also called cricothyrocrycotomy, cricothyroidotomy, inferior laryngotomy, intercricothyrotomy, coniotomy, or emergency airway puncture, is an incision made through the skin and cricothyroid membrane to establish a patent airway during certain life-threatening situations, such as airway obstruction by a foreign body, angioedema, or massive facial trauma. Cricothyrotomy is nearly always performed as a last resort in cases where orotracheal and nasotracheal intubation are impossible or contraindicated. Cricothyrotomy is easier and quicker to perform than tracheotomy, does not require manipulation of the cervical spine, and is associated with fewer complications. However, while cricothyrotomy may be life-saving in extreme circumstances, this technique is only intended to be a temporizing measure until a definitive airway can be established. Indications: A cricothyrotomy is often used as an airway of last resort given the numerous other airway options available, including standard tracheal intubation and rapid sequence induction, which are the common means of establishing an airway in an emergent scenario. Cricothyrotomies account for approximately 1% of all emergency department intubations, and is used mostly in persons who have experienced a traumatic injury. Some general indications for this procedure include: inability to intubate, inability to ventilate, inability to maintain SpO2 90%, severe traumatic injury that prevents oral or nasal tracheal intubation. Contraindications: inability to identify landmarks, cricothyroid membrane, underlying anatomical abnormality such as a tumor or severe goiter, tracheal transection, acute laryngeal disease due to infection or trauma. Small children under 12 years old, a 10-14 gauge catheter over the needle may be used. Procedure: the procedure was first described in 1805 by Félix Vicq d'Azur, a French surgeon and anatomist. A cricothyrotomy is generally performed by making a vertical incision on the skin of the neck just below the laryngeal prominence, Adam's apple, then making another transverse incision in the cricothyroid membrane which lies deep to this point. A tracheostomy tube or endotracheal tube with a 6 or 7 mm internal diameter is then inserted, the cuff is inflated, and the tube is secured. The person performing the procedure might utilize a bougie device, a semi-rigid, straight piece of plastic with a 1-inch tip at a 30-degree angle, to provide rigidity to the tube and assist with guiding its placement. Confirmation of placement is assessed by bilateral osculation of the lungs and observation of the rise and fall of the chest. Needle cricothyrotomy. A needle cricothyrotomy is similar, but instead of making a scalpel incision, a large over-the-needle catheter is inserted, 10 to 14 gauge. This is considerably simpler, particularly if using specially designed kits. This technique provides very limited airflow. The delivery of oxygen to the lungs through an over-the-needle catheter inserted through the skin into the trachea using a high-pressure gas source is considered a form of conventional ventilation called percutaneous transtracheal ventilation, PTV. In popular media. On the TV show MAS*H, Father Mulcahy performs an emergency cricothyrotomy on a patient. With the direction of Dr. Pierce via radio, he uses a penknife and an eyedropper to perform the operation. Needless to say, this would be extremely dangerous in real life. Even under ideal, clinical conditions, a cricothyrotomy is difficult and requires specific tools, preparation, and a practiced knowledge of anatomy. There are many major blood vessels and nerves in the neck, and cutting there carries a high risk of harming the patient. In the 1980 Nicholas Roeg film Bad Timing, Teresa Russell's character Milena Flaherty has an emergency cricothyrotomy performed following an intentional overdose. In Grey's Anatomy, emergency cricothyrotomy is mentioned in at least 3 episodes. In Owner of a Lonely Heart, Christina almost performs an emergency cricothyrotomy on a patient who swallowed a light bulb. Before she is able to do so, however, Dr. Burke shows up and takes the patient to an operating room where he proceeds to perform an emergency thoracotomy. In the heart of the matter, Izzy performs her first emergency cric on Camille, a niece of Chief of Surgery Dr. Richard Weber. In I Saw What I Saw, Alex performs a cric on the patient who later dies. In the ER episode Reason to Believe, Dr. Carrie Weaver performs an emergency cricothyrotomy on a student. She is shooting a news segment on childhood obesity in an elementary school cafeteria when one of the students begins to choke. After the Heimlich maneuver fails, she performs a cricothyrotomy with a kitchen knife and a drinking straw. It is also used many other times, especially in the trauma room, when an airway can't be established. In the film Playing God, 1997, David Duchovny plays a famed LA surgeon, stripped of his license due to drug abuse, who finds himself witnessing a gunfight at a bar. He saves a mafia crime figure by performing an emergency cricothyrotomy. This endears him with the mafia family and drives the plot forward. In the BBC Three medical drama Bodies, the main protagonist Rob Lake, a newly appointed obstetrics and gynecology registrar, played by Max Beasley, is called to a patient who is having difficulty breathing due to epiglottitis. Lake calls for emergency assistance but help is slow coming, so fearing for the patient's life decides to undertake a cricothyrotomy himself, a procedure he has not been trained in. The procedure is unsuccessful and the patient dies before help arrives. The guilt surrounding the event combined with the covering up by his consultant provides an important backdrop to the further development of the character and his relationship with his consultant. On Dr. Quinn, medicine woman, Sully, the white man raised by Indians who is her lover and companion, performs the procedure on one of Dr. Quinn's boys using a bird's feather, the base where it is hollow. During an episode of the National Geographic Channel documentary Inside Combat Rescue, a U.S. Air Force pararescueman in Afghanistan performs an actual cricothyrotomy on a wounded civilian in a helicopter maneuvering under combat conditions. The procedure is successful and the patient is delivered to Kandahar Regional Medical Hospital. On the New Zealand soap opera Shortland Street, Series 21, Episode 5104/5105, student Dr. Paige Monroe performs a cricothyrotomy with a pocket knife and pen and saves a woman's life, even though she was not qualified, and nervous. In the novel Night Train to Lisbon by Swiss author Pascal Mercier, one of the protagonists saves the life of his asphyxiating sister by performing a provisional cricothyrotomy with a ballpoint pen. In the 1997 film Anaconda, when the character Dr. Stephen Cale, Eric Stoltz, is stung in the mouth by a poisonous wasp found in his scuba equipment, Paul Cerrone, John Voight, performs the procedure using a pocket knife and rigid plastic tube.
Please subscribe and thanks for watching.